Hey everyone, my name is Christopher Chu, and I'm an allergist at Atlanta Allergy Asthma. This roundtable that we're having today brings together multiple members of our physician community to discuss disparities in allergy care and food allergy preparedness. I'd love it if we could go around and continue introductions, and then we can get into it.
Sure. I'm Mohamad Tawila. I practice in the Midwest, private practice in allergy and immunology. We are affiliated with a very large teaching-based hospital, seeing both urban, suburban, and rural patients, both pediatric and adult. Been in practice about 30 years. We have 4 physicians and 8 extenders with 3 office locations.
Awesome. I can go next. I'm Denise Powell. I'm a pediatrician here on the Mississippi Gulf Coast. I work at a community-based clinic, and I'm also a former climate and health equity fellow. It's nice to see you all.
Hi, I'm Dr. Sahiti Musti. I am a medical professional, a healthcare expert, and a clinical nutritionist as well. And I treat a number of allergy patients and other coexisting conditions. I have a public health clinic in the greater Chicago area, and I also take teleconsultations from all over the world in UK, India, and USA as well. And I have an MPH from the University of London School of Hygiene and Tropical Medicine, and it's lovely to be a part of this rich conversation tonight. Thank you that I'm getting this opportunity.
Great. So I wanted to start off by saying that food allergy prevalence has been increasing for decades. Our practice sees endless patients with undiagnosed food allergy, often referred to us from our pediatricians, primary care doctors, urgent care, or even emergency rooms. What are some areas of concern, signs that would alert patients or parents that they may have an undiagnosed food allergy in your experience?
For us, really, it comes in a very varied presentations. Certainly, abdominal symptoms and complaints are certainly a frequent entity that we are confronted with. Sometimes we have to consider things in the realm of esophageal problems, EOE, that sometimes and include the food allergy consideration. Beyond, of course, things like eczema and rhinitis and asthma that we often deal with.
And going off of that, I think the biggest educational thing that we do in clinic is making sure that kids and families know that there's a large variation and what that presentation can look like. So a lot of times, anaphylaxis is the big things that come up, but we also talk a lot about the fact that you can have milder symptoms and how to treat that spectrum of allergy management as well.
And Dr. Tawila, I know that there are so many variable signs of inconsistent presentations, such as food intolerances. How do you work between that and proper anaphylactic type food allergy?
So certainly it is definitely in the history presentation, and certainly the intolerances, we really pin patients and the parents down specifically what are the symptoms they're presenting with. Are they mostly limited to GI abdominal discomfort, bloating, loose stools, constipation, diarrhea, that sort of presentation, as opposed to the child who has what we call the true anaphylactic, where there's true oral airway involvement, difficulty breathing, rashes, hives, and even drop in blood pressure, and obviously the true anaphylactic picture with significant mediator releases. And then, of course, is followed up by testing to confirm the suspect foods by either a blood or skin test, and then sort of trying to collaborate and basically correlate the symptoms with the findings.
So once they come to you with these symptoms, when do you guys seek proper diagnosis? When do you seek referral? What steps should adults or parents take in that regard?
I think when we speak about that, one of the important things I would like to touch upon is that I think patients also, patient education is super important in that area. I think based on them being well informed about the triggers, the environmental modifications, and how they can minimize their exposure and come report to us is when taking the right call on referrals can be made. And also, I think it's really important in today's day and age that advanced diagnostic tools and personalized medicine should be thoroughly integrated into the patient care. And I think that tailored treatment and that tailored referral from case to case based on what we are dealing with, based on their individual sensitivities and profiles, is something that I like to specially take care of. I think I think you would be able to add better to that.
You were mentioning about when to refer them out. I think, Dr. Chu, is that you were asking part of the question. So obviously we are getting, as a specialist, we're getting referred patients for evaluation of a food allergy and to confirm intolerance, allergy, or nothing. I think the only point that we refer beyond that would be, again, to a gastrointestinal specialist when we're concerned about possible EOE or other maybe food intolerances, to maybe get involved, opinion from them. And then we do sometimes refer patients out for, we used to more so than before when we used to get involved with oral immunotherapy, which we didn't do much in the past. We're getting more involved with that now. And advent of other new therapies that have come along the way that allows us to become more involved with that aspect of their care.
I wanted to add that pediatricians, primary care doctors, they'll often draw blood levels, like IgE levels for foods. And in the past 5 or 10 years or so, that component testing has gotten very important. And it's a helpful tool that allergists like us will use to further suss out the intolerances versus the proper food allergy.